Hey, it's Dr. Murphy. So, you've just been diagnosed with prediabetes. Now what? So, we'll talk today about what you can do to reverse prediabetes. So, what is it? It is when your blood sugar is elevated. So, if you are fasting, meaning you haven't eaten for 8 hours, your blood sugar should be below 100. With prediabetes, your blood sugar is between 100 and 125. Diabetes is when it hits 126 or higher. So, your A1C is another number your doctor may check. That with prediabetes is between 5.7 and 6.4. Now, the A1C does not tell us what your blood sugar is in that moment of time. That tells us what your 3-month average blood sugar has been. And so it gives us an estimate on a day to day basis of what your average is. Now, once you have the diagnosis of prediabetes, your doctor will likely talk to you about lifestyle changes because you really can make a big difference in your blood sugar numbers with simple lifestyle changes. Now, part of lifestyle change is changing what you put inside your body. So that could be what you're eating, what you're drinking, or even medications that you're taking. So when it comes to food, you really want to cut down on things like simple carbs or sweets, white bread, white rice, white pastas, and try to get more of the whole grain, whole wheat types of breads and pastas. You can eat plenty of vegetables, whole fruits, nuts, legumes. All of those are really good for your blood sugar. And some of those also have fiber, which is really good at helping your body regulate that blood sugar more efficiently. When it comes to drinks, water and sugar free beverages are the way to go. You want to try to avoid the sodas, sweet tea, and fruit juices that have added sugar. Also, alcohol has sugar as well. Now, when it comes to moving your body and exercising, we want for you to try to get at least 30 minutes of aerobic exercise 5 days per week. That could be a brisk walk. You could go for a swim, cycling, anything that gets your heart rate going. And we also want you to focus on resistance exercise. So that could be lifting weights or doing push ups, sit ups, squats, things that's helping to build your muscle. When you have an increased muscle mass, that helps your body process sugar more efficiently. Aside from that, we want you to also measure your weight because if you are overweight or obese, you can make a big difference in your health by losing at least 5%. So, for example, let's say you weigh 200 pounds. 5% would be 10 pounds that you would need to lose to have a significant difference in your blood sugar. And we see even greater effect when you lose 10% or more. And with you doing the healthier eating and exercise, that alone is going to help you lose weight. Now, if you have ideas of things that you've done that have helped you get your blood sugar under control, please leave those in the comments so that other people can get some ideas. And also, be sure to like this video and subscribe to the channel. So, we just talked about the lifestyle changes that you could do, which included diet, exercise, and losing weight. But there are some instances where we can use medication to help with prediabetes. We usually reserve that for the people who have the higher levels of blood sugar that puts your A1C between 6 and 6.4. Or if you have other health problems that just put you at a higher risk, then we would consider medication like metformin to help get your blood sugars under better control. But thankfully, most times we don't have to use the medicine and we can just make a big difference and reverse the disease with these healthy choices. And also, Most people with prediabetes do not have symptoms. So that's the importance of making sure that you're getting your physical every year and keeping your follow-up appointments so that you can have this routine blood work, because usually that's the first sign when you're in this range. And although you may not feel anything, that doesn't mean that your body isn't undergoing changes inside. So blood vessel damage and nerve damage actually starts in the pre-diabetes phase, although you feel fine. So just keep that in mind and do your best at getting this disease under control as quickly as you can. So thank you for watching. I hope this information was helpful. Until next time, take care.